Healthcare is the cornerstone of any society, as healthy citizens are its greatest asset. However, it should not be a question of income, but that of a fundamental human right. The Sustainable Development Goals place health squarely at the center of any developmental agenda and champion it as a key driver of economic progress, with SDG 3 aspiring to ensure health and well-being for all. To align with international commitments, Nigeria's health sector is designed into 3 levels: primary, secondary, and tertiary. But how has the country fared in the last 60 years?
As a nation, if we look back, 1960, at independence, just look at the figures. Nigeria had a population of about 45 million. The United Kingdom, our colonial power, had a population of 52 million. Now, in 2020, Nigeria has a population of 206 million, estimate. And the United Kingdom just has a population of just over 60 million, 67 million. So there's just over 10 million increase in the United Kingdom, their population, from 1960 to 2020. Whereas we've had like over 5 times population increase since that time, and growing, and this is unplanned. So imagine those kind of indicators, population on our health system, coupled with the fact that there has been very little investment and planning in the health sector in Nigeria. My father was explaining, he was a surgeon in the 60s, how at independence Nigeria was so attractive in the health sector internationally that we had doctors coming from the United Kingdom to do their residency here because the salaries were much better then than in the UK. Just compare that to that now.
To say that they have done fairly well in the sense that there is so much that is still to be done. For example, if you want to look at the area of healthcare financing, healthcare budgeting, you'll find that Nigeria still isn't budgeting enough for healthcare. Out of pocket is still the dominant method for healthcare financing. So yes, in that aspect, I would say they've really not done well. If you want to look at the area of human resource for health, you want to look at doctor-patient ratio, nurses-patient ratio, healthcare worker-patient ratio, you find out that we are really still lagging behind. So that is also not a good mark for Nigeria.
SDG agenda also requires a bold commitment to end the epidemics of AIDS, tuberculosis, hepatitis, non-communicable and other communicable diseases by 2030. Key players believe it goes beyond signing treaties. Increased funding, political commitment, especially implementation in the sector, are paramount.
Depend on a lot of funds from donors, and there's what we call the donor fatigue. Donors have started pulling out of Nigeria, and this has led to the collapse of a lot of things that have been put into place before, like the HIV program, the TB programs, and all that. So that's in terms of our healthcare financing. Health information management systems is also very important. We cannot overemphasize the need for good data control, the quality of our data we're generating, because it's from data that we can actually plan programs. You can monitor and evaluate the health system. You can use data for so many things, but yet we have so many issues with health information management system, funding being top of the list.
I don't see government doing so much on their own, but they can do so many things with the PPP. And public-private initiative, and get people who have run businesses to run our hospitals. Because I believe strongly that the hospital business is a very good business, but it needs to be well run. And so if we can do that, yes, the facilities will improve. Nobody should tell me about free health. It's a pipe dream. It's not possible. Not even in Nigeria, that we can't even treat anything. So politicians should leave healthcare alone. It's not a field for them to play in. Let professionals play in healthcare, and let's see that we have good facilities.
Despite the manpower, skills, and dedication, malaria, maternal and child mortality rates are basic but challenging issues facing the health sector.
The global world is going technological. We should be talking about telemedicine, whereby people get to be a kind of consult their doctors, consult with their specialists via online. You can easily do that with an app on your phone, so that it will be that the only time you will have to see a doctor will be necessarily because there is need for you to have some diagnostics, possibly technological diagnostics like MRI, EEG, and some other things. But when it comes to diagnostics in terms of questions to be asked about what is wrong with you and all those things, I think all these things can be done online, so that a lot of people will have access to their to specialists, and at the same time they will be taken care of without necessarily migrating from one part of the country to the other.
More research institutes have to be developed. We have to invest heavily in locally produced medicines, in vaccines, in health technology that would help us as a nation. And then finally, we look at our service delivery. Currently, we operate the primary, secondary, and tertiary level of care. But unfortunately, what we see is that a lot of money is being pumped into the tertiary level of care. And when you look at it in terms of preventive and curative, we have more of our health budget going into curative health care as opposed to preventive. And it's preventive that actually reaches a large amount of people.
Healthcare remains vital to all, some of the time, but public health is vital to all at all times. When compared to pre-COVID-19 era, many advocate that collective efforts during the pandemic, if sustained, will boost major transformation needed.
How do we take lessons like that, going forward? How do we ensure that private businesses even contribute to epidemic preparedness? Because as it is now, there's no business run in most places. So how can we even ensure that businesses will begin to contribute a certain percentage of their income? The basket funding kind of mechanism where private businesses can contribute their own percentage to epidemic preparedness. And I want to see that Nigerians become a bit more responsive to their healthcare. In Nigeria, we really don't, as a people, we don't care so much about our healthcare. I think a lot has to do with religion. What people tell is not their portion, things will not happen, but we see that things happen. I want to see Nigerians stand up more to begin to hold government at different levels accountable for quality healthcare, including what are you doing to ensure that COVID-19 or something like that doesn't happen again.
A major achievement in Nigeria's milestone is making the country polio-free. As Nigeria celebrates 60 years, it is believed that if the nation and our leaders start well now, the country will get it